Namaste. Working in a hospital at Saita, people often ask me this question: what is the difference between yoga and yoga therapy? And this question is, I think, a very common one wherever you go. Being a yoga therapist, what is it that you should feel, or what is it that is different from a normal yoga instructor or a yoga teacher? So as a yoga instructor or a teacher, it is just that we learn to do the techniques, we experience in each and every technique, we go through a few of the experiences ourselves personally, so that when you are going to teach and when you are going to do a therapy session with an individual, it is going to help you or guide you as to how to take forward that particular technique. Be it an asana or be it a pranayama, what is the difficulty that you felt? What were the pitfalls that was there when you were doing the practice initially? And how is it now as you are doing it after later, maybe a year later or 2 years later? So this is something that we need to understand before we take it forward to anybody, especially as a therapy. Normally this is one line that we say: listen to your body. Listen to your breath. So this is something that's very important when you are a practitioner yourself. Be it being a teaching or a therapy or wherever it is, first that is a base rule where you need to be listening to your body, listening to your breath, because unless and until you do that, you will not understand what your own limitation is. Can we do it a little more, stretch it a little more? Are we stretching, or is it becoming a strain on the body? So this is something that we need to be listening to the body, open-minded, and to the breath also, because whenever you are straining, you are overdoing it, your breath will definitely stop. It will not be normal. If you listen to the rhythm of the breath, is it rhythmic? So this is something that we need to be, aware of as a practitioner. And this is something now, when you become a therapist, apart from being empathetic, apart from the empathy aspect and all that, more than all that, it is now you will be listening and seeing the other person's body and breath also. So you need to be as empathetic as listening to that other person in all the spheres, I would say. Not just sitting down and talking to them, giving them counseling, or not just that. When you're making them do a practice, are they able to do? Are they doing it properly? That is second. The technique, the perfection of the technique, all that comes later. But are they able to do it? Are they able to stand on their feet properly? You have to be doing the listening for them. Are they doing it properly? Are they stretching or are they straining? So it's not enough if you do it. It is like you have to be able to do it for the other person also. That is when I would say you are becoming, at least trying to become a therapist. Otherwise, the technique, it's not just the technique. It's not just what is the technique, how to do the technique, or how do you take it forward, what is the perfect technique. That is all secondary. But making the other person do it is something different. And you can motivate them by saying, this is the final posture, but today you're able to do it this way. But go on doing, that is the motivation, that is the inspiration. Because you could just set yourself as an example. You could say like, I was here and now I'm able to do it here. So that is the best motivation that an individual can have, that you can do better than me, and this is not the limit. You could discover or you could invent a new posture by yourself.